I know that we've been on before, happy to be back. And I'm kind of at your request going to chat about some supplement and diet considerations. And I'm going to kind of focus on sporting and aging dogs because I think that was some particular interest to you guys.
Mhm.
I'll try to do some stops along the way to ask for questions, but feel
Good
free to
boy.
shoot up a hand as well so we can kind of get anything answered you might have. Okay. So we'll first start with kind of a sporting dog consideration. So we'll talk a little bit about diet considerations and some maybe performance supplements that might be useful. Then we'll jump into something that is always of interest with dogs that are sporting as they age. So dealing with osteoarthritis, both diet and supplement recommendations for dealing with that. And then we'll jump into aging dogs. So some of the common things we see, like muscle loss associated with age and cognitive decline, or providing cognitive support as dogs age. So whenever we talk about supplements, I want to make sure that everyone understands where supplement regulation is in the United States. So a lot of times we're going to recommend the use of actual human supplements, so supplements that are made for human consumption for our dogs or felines. And those supplements are going to fall under the Dietary Supplement Health and Education Act, which means that they're actually not being looked at and kind of stamped with approval by the FDA before they're made for sale, whether that's online, in a store, etc. So really the FDA is only going to look at those supplements if there are flags raised. So if someone complains to the FDA that maybe they think their pet or a person had an adverse effect, they might look into that supplement and then take it off the market if they do think there's a problem. So really anyone can kind of whip up a supplement, put a label on it, put it up for sale, and there's no regulation to say that that actually contains what the label says that it contains. For animal supplements, so supplements made for animal consumption, we're largely dealing with the same thing. So it's pretty much after the supplement goes up for sale, that's where the surveillance is happening, unfortunately. So we need to be really prudent about which supplements we recommend for our patients or for your pets, because we need to make sure that they actually contain what they contain. They don't have anything scary contaminant-wise in them to make sure that they're actually going to be beneficial and not harmful. So ways we can do that. Your veterinarians have the advantage of being able to look through the literature to see what supplements might actually be advantageous for a given disease process. So looking at clinical trials to say, yes, this supplement does have a positive impact in animals with arthritis, for example. From a consumer standpoint, you can look for these seals on the supplements that you're purchasing. So for human supplements, you're going to look for something that says like good manufacturing practice certified. So that means that that supplement that's made for people has elected to be part of this group where an external service comes in, looks at the manufacturing practices, and says, yes, you're making this appropriately. This looks like a good quality supplement that's safe to consume. From the animal side, we have the same thing with the National Animal Supplement Council. So if you're buying a supplement made for animals, you can look at this NASC seal. And that again says, okay, someone external came in and said, okay, this supplement is being made in the appropriate way, should contain what it's supposed to contain, and be safe to eat for the animal. We also are members of this website, which is called consumerlab.com. So you have to pay to have all the information from this website. So a lot of veterinarians are members, but you may not be, which is okay. But they actually purchase supplements and independently test them as well. So they're going to test contents of different fish oil supplements, for instance, see what their concentration of active ingredient is in the supplement, test for common contaminants like mercury, make sure they're in safe levels, and then put their stamp of approval on them. So lots of different ways we can make sure that supplements are appropriate quality and safety. All right, so now I'll jump into sporting dogs. First of all, does anyone have questions on the supplement regulation or how to make sure a supplement is safe before I jump into the sporting dog diet?
Yes. Sure.
I don't see any hands, so we'll keep going. So this is a nice table that one of my colleagues and mentors from Cornell and also my mentor in my residency at UF kind of put together. So this is looking at calorically, what kind of an increase in calories do dogs need depending on the sport that they are performing. And I know a lot of you guys have field trial dogs, maybe hunting dogs. So that's going to be kind of the moderate level. So we're looking at compared to a companion dog, we're having an increase in caloric consumption to support the activity they're doing in that sport of somewhere between 25 and 100%. So it might even be 2 times the normal amount of calories for a companion dog that your dog would need in order to maintain its appropriate body weight. When we get into hunting dogs that are working more than 3 hours a day, or certainly sled racing dogs that are working the majority of the day, we see them getting up to even 5 to 7 times the caloric needs of a normal companion animal. And we'll jump into kind of how we go about getting those calories into those dogs because volume of food becomes an issue. With things like obedience, agility, disc dog, those are really more like sprinting sports. It's a bit briefer. Certainly, if they're doing multiple sports, they might be going into this moderate category. But a lot of these more sprinting or short duration sports, they really don't need a ton more calories than your typical companion animal. So we're usually not having to go into, more calorically dense performance diets for those specific sports. So we'll get into this a little bit deeper. Beyond just calories, we think about where the calories are coming from. So there's 3 categories where calories come from in food. It's going to be carbohydrates, fat, and protein. So for all sporting dogs, we're going to want protein to be in the moderate to high category to make sure that we're supporting their lean muscle mass, their muscle recovery, etc. As we get into the more endurance athletes, that's going to push up higher to the high protein level. So close to this 90 grams of protein per 1,000 calories. And we can kind of look at that on the food label or do a quick calculation to find that out. Beyond just standard protein, we're also going to look at some specific amino acids. So we actually have studies looking at specific amino acids in muscle recovery. And we know that specifically for the amino acid leucine, getting that into a higher category in the range of 3 to 6 grams per 1,000 calorie is actually helpful for muscle recovery. So helpful for not only repleting the glycogen or carb stores within the muscle, but also making the protein synthesis after activity to make sure if muscle is broken down during the activity, we're building that muscle back up. So we want to make sure that most of our sporting dogs are, again, in that moderate to high protein category. The next place that calories are going to come from that we think of is going to be carbohydrate. So with carbohydrate, it's helpful for our more endurance sports. So in the last slide, these kind of moderate activities to these high, more endurance activities, anywhere in here, it's helpful to give a little bit of carbohydrate immediately post exercise. So within about 30 minutes of a longer activity exercise, if you give carbohydrates, it'll help replete that glycogen store within the muscle so that they're not behind on their ability to expend energy the next day. So especially if you have a dog that's in intense training before a competition or in a multi-day competition, that repletion of carbohydrate within that 30-minute range after activity becomes more important to maintain that performance over a few day period. Carbohydrates are a little bit bulky. So when we get into the really endurance dogs, the dogs that are doing a long duration of work each day, they're going to need a lower carbohydrate diet than other dogs because it's not as calorically dense. We can get a lot more calories from volume with fat. So we have to increase the fat in the endurance dog diets to make sure that we're getting them the calories they need in a volume that they can actually intake in a day. So I put on here one of these brands. I don't know if you guys have heard of this, a Inukshuk brand. So this is kind of known in the sled dog world, but this is the highest caloric density food that I know of that's on the market. So it's actually 720 calories per cup of food. And that's going to be for these more very high endurance sporting dogs. These other ones are in the more moderate category, so not quite to the high level of calories and high level of fat of this diet, though this diet line does have multiple other options that are less fat and less calorically dense for your more moderate sports. But these are some other ones that we'll commonly use in more of our moderate sporting dogs. And there are many out there, but these are a few that I've turned to in the past. So ProPlan Performance 3020. We have Eukanuba, which has a whole line of kind of sporting performance dog diets. And then Animate is one that's actually made up north, but is all kind of USA made and sourced for nice quality food. And they have a nice sporting dog line as well. When it comes to supplements for sporting dogs, we have some literature in the veterinary looking at this. So like I mentioned already, looking at carbohydrate supplementation after exercise within that about 30-minute mark. And there's some evidence more from the human side that providing some protein, especially some specific amino acids like leucine, in that kind of immediate 30-minute period can be helpful for muscle recovery as well. So there's a couple supplements on the market that are targeting this for dogs. This is from the brand Animate, which is the same brand that made one of the diets on the previous slide. And actually, my mentor from Cornell has done a lot of work in research with nutrition for sporting dogs, formulates for this company. So he made these specifically for sporting dogs. There are other things you can do too. For instance, you can find a whey protein shake like a human would take, as long as it's a vanilla flavor, a flavor that's safe for dogs, as long as it doesn't have xylitol as an artificial sweetener, which is toxic to dogs. That can be a nice option for a little post-workout combination of carbohydrate and protein. There's been some work looking at scents and the type of oil that's in the dog food. So we know that if you're giving too much medium chain triglyceride oil, so this is coconut oil or straight up MCT oil, that can actually reduce a dog's ability to sniff out or detect something if that's part of their sporting work. Whereas if we supplement omega-3 fatty acids, so something like fish oil, that can actually increase their ability to detect what they're trying to detect via sniffing. So something to keep in mind if you do have any type of sniffing work with your sporting dog. As you guys probably know and have seen in some of your more anxious dogs, some diarrhea or stress colitis can happen around high intensity training, traveling for competition, etc. So there is a specific kind of amount of fiber we look at for sporting dogs that can actually help to prevent stress colitis or stress diarrhea and help to make it less severe and kind of go away a little bit faster. So we still want the fiber for sporting dogs to be a bit on the lower side, lower to moderate. Definitely not too much fiber because we don't want to kind of bulk them down or make their GI tract not travel fast enough. In addition, we can think about probiotics. So I put one of the common probiotics on here. There are many available for dogs that are safe and good to use, but this is a common one that a lot of veterinarians are using that you can actually use before a stressful event if you know that your dog is predisposed to this. So if you're about to be traveling, you could start a probiotic maybe 5 days prior and through the traveling time period to try to avert the diarrhea that might happen because of the stressful traveling or intensity of their work. Okay, I did put this up here. I forgot to mention this is one of the common fiber supplements we might recommend. If they're on a very low fiber diet, you could always add a little bit of this kind of psyllium husk powder. So this is essentially Metamucil, but without the flavoring. So without the kind of orange flavor, you could just put this powder on their food to the appropriate dose, depending on their body weight. Okay. Any questions there before we jump into osteoarthritis supplements and diet? Okay, we'll keep going. So for osteoarthritis, we as veterinarians are going to think about a bunch of different things when we have a dog with arthritis. We need to think about what's causing the arthritis. So do they have unstable joints like hip dysplasia or abnormally shaped joints like elbow dysplasia? Do they have an injury to their joint like a cruciate ligament tear? If we have a known underlying cause, we need to address the underlying cause to try to prevent further arthritis progression. On a more microscopic level, we also need to think about what's happening in that joint at a cellular level. So we need to think about all the inflammatory mediators and limiting the damage that they're doing, limiting the damage of reactive oxygen species that are kind of wreaking havoc in the joint as well, and providing the joint with factors to help build it up and become healthy again. So you've probably heard of like glucosamine chondroitin, maybe type 2 collagen. They're going to fall within this category. Adequan is also going to fall within this category, but is an injectable option. Of course, we need to control the dog's pain, so supplements can help with this, but we may need medications as well. Weight management we'll get to with diet for osteoarthritis. It's super important. And then on kind of the whole dog level, we need to think about maintaining joint range of motion and also strengthening the muscles that are right around that joint that's painful. So the more muscle strength we have in that limb, and especially in the muscles around that joint that is painful and arthritic, the less force is actually placed on the joint itself. So targeted exercise and strengthening becomes important too. So these are all the things that we think about when we have a dog with osteoarthritis walking to our clinic. We're going to think about diet, lifestyle, work, sporting adjustments, supplements, targeted rehab. If we need to think about a modality like laser therapy or something, shockwave therapy, something like that. If we need medications initially to get pain under control while we build up these other things to hopefully not need medications all the time or lifelong. Do we need to inject something into a joint to help make it healthy? Is it that level of an issue? Potentially acupuncture for added pain management, but we'll focus on these. So for diet for osteoarthritis, the first most important thing is keeping your dog, and I'm probably preaching to the choir here with this sporting group, but keeping your dog in this realm. So in the body condition score, that's nice and lean. So if they're overweight at all, we're going to increase lameness, we're going to increase inflammation in the body and make our arthritis worse. So that's first and foremost.
When I was at the vet's yesterday, a golden came in.
You might have lost her. But yeah, I mean, we see overweight animals all the time, and I'm sure that you are keeping your guys nice and trim with all the activity they're doing, but it's a big battle for us with a lot of companion animals. So when we are thinking about feeding for a dog with osteoarthritis, whether we're trying to maintain muscle mass because of maybe not using the limb as much, or we're starting them on a weight loss plan, we're going to kick their diet typically into a more high protein diet to try to make sure that we're maximizing this muscle strengthening around that arthritic joint or maximizing the maintenance of muscle mass if we're decreasing their calories for weight loss. So if we're doing that, we're going to be looking for either a diet that meets this amount of protein, or we might be adding in protein supplements. And I actually put together this table for the vet students as kind of different options of lean protein supplements you could add onto food if we're looking to do that. When we're looking at foods for osteoarthritis, there are a lot of prescription diets out there. There are a lot of non-prescription diets out there that can be beneficial. The main thing that these diets tend to have in common is supplemented fish oil. So if we look here at this chart, this is a nice review of lots of clinical trials that have been done in dogs over the past probably 20 or more years, looking at different supplements, diets, and nutrients for management of arthritis. And you can see in this therapeutic diet category, the majority of clinical trials, so 90% of them, showed improvement in the dogs that were getting the diets compared to placebo diets. What these diets have in common is supplemented fish oil, a moderate to high protein level, and most of them will supplement some amount of glucosamine chondroitin as well. There are some other things that some of the diets choose to include, such as green tea extract, maybe some calcium, other curcumin is in one of them. But the commonality that really makes these diets work is going to be that protein level and fish oil level. Which brings me to supplements. So by far, the most evident supplement we have for improving osteoarthritic pain is going to be fish oil. So if we're adding fish oil, it's going to have EPA and DHA in it, as opposed to just if we're not giving any fish oil, we're only going to have omega-6 fatty acids in the diet, which are going to yield these high inflammatory mediators. If we add fish oil, now we have EPA and DHA in the body, and we're going to have anti-inflammatory mediators as well. So it's kind of this balance between omega-6s and omega-3s, but not all diets have omega-3s. So making sure we have that, and it's in a form that has EPA and DHA, which means it has to be a marine form. So fish oil, krill oil, or green lip mussel. If we are looking at omega-3 fatty acids for osteoarthritis, we're looking at a higher dose than for most other things that we'll use fish oil for. So I put that dose here, but your veterinarian could help you with this as well. And these are some of the common supplements that we typically recommend. So these are going to be higher concentration fish oils in a liquid form or in a capsule form that have appropriate seals, low mercury levels, so they're nice and safe and efficacious. Green lip mussel is coming up. There's quite a few clinical trials showing that green lip mussel seems to work as well. So green lip mussel also has omega-3 fatty acids in it. In addition, it has some other things that help to build up the joint cartilage. So kind of a combination. The common ones on the market you'll see, and probably the one that's been researched the most is Antinol Plus, but You Move is another one that's well researched. I know this has become a popular one in the agility world, but either one of these would be reasonable. This is a newer brand that's come up, but we're starting to see a lot of dogs come in on it, and they have some green lip mussel in their product as well. I put the dosing up here of the studies that have shown benefit. So this is going to be in mg per kg body weight of dog per day. And it seems like the lower dosing, so lower than this dose, there were some trials done that didn't show benefit, so dosing does matter. UC2 also has about 5 controlled trials in it in osteoarthritic dogs that show unanimous improvement. And we can see here in this kind of review of all the clinical trials, collagen similarly to fish oil over here, and the therapeutic diets that largely contain fish oil is in that like 85% group of dogs are going to be showing improvement. These are some common ones that have UC2 on the market for dogs, but there's also a lot of human undenatured type 2 collagen capsules that are actually cheaper, of decent quality, and are also an option for dog supplementation. The only dose that's been looked at for undenatured type 2 collagen in dogs is 10 milligrams of UC2 per dog per day. And it's based on how it works. So it's actually training the immune system not to react to the joint cartilage if the white blood cells get into the joint because of inflammation from arthritis. So it's not really weight dependent. It's really just a dose per dog or per person per day. And then you guys have probably heard of CBD oil. So there's lots of these on the market for dogs. There's lots of these on the market for people. This is one where we really, really need to be careful about which one we pick. So I want any CBD supplement I recommend to have another outside laboratory testing for CBD concentration and for THC concentration. So like what's in marijuana that we don't want our dogs to have because it's toxic to them. So we need to make absolutely sure that the quality is good and that they have an external laboratory, not their lab, but another lab testing and making sure that their CBD product is appropriate. It is safe. It does seem to work for osteoarthritic pain. I usually save this until very late stage arthritis because I don't think it does a great job at preventing arthritis progression, but it does do a nice job at working at a different point on the pain pathway and helping to limit the pain the dog feels from arthritis. So when we get into the more late stage arthritis and we're dealing with quality of life and pain, this is something I might add in. And that's up here on this nice review paper as well. So again, similar to the collagen, we're in about sorry, I'm in the wrong sections, these two, 85% showing improvement. This is the supplement product that's made for dogs. It's called Elevate, which has been researched the most and shown to be efficacious for dogs with arthritis. They do a really good job with their manufacturing and testing with outside laboratories. And this is the dose that we're using, which is the same that they're recommending on their packaging. Glucosamine chondroitin is one of the most long-standing supplements that's been looked at in humans and in dogs. So this is going to be providing building blocks for the cartilage to help when the cartilage is being broken down to kind of balance that by building up more cartilage, if you will. So we know that it's safe. We know that it's bioavailable. The only question is how effective is it? We have a lot of studies in dogs, and the results are mixed. So some show benefit, some don't. In the ones that show benefit, not all the dogs are benefiting. Some of the dogs are benefiting. And it's the same for people. There is a nice study in people that actually spanned 2 years that showed doing a high dose of glucosamine and chondroitin once a day yielded the most benefit in preventing degradation throughout the 2 years. So largely what we're moving to in dogs is if we're going to include this as a recommendation, we're going to dose it high and only once a day, similar to what they found to be efficacious in people. When you look at this review paper that looks at all the randomized controlled trials for glucosamine and chondroitin in dogs, the majority of those, I think it's almost 90%, didn't show any significant improvement across that group to the placebo group. So is it that they were dosing too low? Is it that they weren't dosing high once a day? Or is it just not the best choice for the majority of dogs? So it's not going to be our first choice these days, but if we're going to use it, use a higher dose once a day. Any questions on that before I finish up with the aging dog, muscle loss, and cognitive support?
I have a question.
Absolutely.
Is salmon oil, does that give any benefit?
Yeah, salmon oil, same as fish oil.
Fish
So
oil. Okay, thank
you. Typically where they're sourcing the fish oil is going to be from salmon because it's one of the highest amount of EPA and DHA fish.
Okay, great. Thank you.
Yeah, good question.
I have a question too.
Yeah.
I always gave my dog salmon oil too, but I switched food, and now I know that they put salmon oil, fish oil in the food. So I'm worried about giving him too much. When I control it, I know, but how do I know what's in the food and dose it that way with what the bottle says, a pump based on the weight? I don't want to give too much.
Absolutely.
I know the food. That's where I'm confused at.
Yeah, so I will say if it's not a prescription diet, there's usually room to give a little bit more fish oil, but potentially like half of what we would normally give from the fish oil itself if it's in the food as well. If you're on a prescription diet that has fish oil, like the joint diet from Purina or Hills or Royal Canin or one of the other bigger brands that has a joint diet, usually it's dosed high enough where you actually don't need more fish oil to add in.
Okay,
So
thank you.
I have a question on that. So if you're feeding like ProPlan salmon and rice, is it necessary to give additional salmon oil? Are we doing any harm by giving additional?
If your dog has known arthritis, I would give more if it's a non-prescription diet. So even if it's salmon-based, they're not dosing as high as the prescription diets in the over-the-counter diets. So rather than give maybe the dose that it says on the fish oil that's made for dogs, maybe give half of that dose because you do have some in the diet, but you need a little bit more to reach the high dose we're looking for osteoarthritis benefit.
Okay, thank you.
Yeah. And if you have questions about that specifically with your diet and your dog, your veterinarian should be able to look at that dose and help you with it too.
I have a quick question. I have a lot of people asking me, at what age should I start to supplement things like this for joint health? Obviously, we want our dogs at all ages to be healthy, but, does a young, dog 2, 3 years old need any of this? Or what age do you generally say that? Or is it very specific to each dog?
No, it's a great question. And it does depend a little bit. So if you know that your dog has any joint abnormality, so any level of hip dysplasia, elbow dysplasia, a joint that they seem painful on after they're working or sporting, then it's totally reasonable to start these at a young age. The ones that I probably would recommend starting earlier would be fish oil, undinatured type 2 collagen, over the others, or greenland mussel. It's kind of similar to fish oil. So
And
anyone.
those are also great for skin, coat health, all those other things too, right? Yeah.
They are, absolutely. Yep. So I mean, I think even they say in people too, you should be eating some amount of fish per day or per week, right? So getting some of that balance for anti-inflammatory benefit body-wide isn't bad for anyone, even if you're healthy. But specifically for arthritis, starting that younger and potentially starting that undenatured type 2 collagen younger would be advised. Okay. We'll jump into aging dogs. So unfortunately, we do see muscle loss as we age. In humans, it starts around the age of 30. That's the age of about 4 to 5 years old. I know. In dogs, so it's starting earlier than you'd think, but at a slower rate. And especially if you're doing sport training, resistance training, you can combat that. So you guys are already combating that with your dogs by doing a lot of activity. But as they do get older, so as they start aging from around that 4 to 5 range, and especially when they hit this geriatric range, like 8 to 9, that's when it happens more rapidly. So that's when we start thinking about giving a little bit more protein in the diet to try to combat that and maintain their muscle mass. In addition to thinking about adding resistance training like walking or swimming in water, something like that, true resistance or strength training. We already talked about some of the lean protein supplements we recommend. This is another supplement from that same company that's a combination of protein and some other things, but it is a common one I'll recommend if we're looking for both calories and protein with a good amino acid profile for supplementation. We have some new supplements on the market specifically for combating muscle loss. So this is the one that's been used and researched most. It's called Myos. The ingredient that works in it is called fortotropin. It's derived from egg yolk, and it actually inhibits muscle atrophy. So they've looked at it in older people, they've looked at it in dogs following knee surgery and older dogs, and it does a nice job of inhibiting further muscle atrophy. Combining this with a high protein diet and some type of strength or resistance training is recommended, but it is a nice option that we have available to us now. And this is that supplement. So we have a couple of studies looking at the levels of different things that inhibit muscle in the body, showing that it does work, as well as measuring muscle mass after knee surgery and looking at function in older dogs related to osteoarthritis. So we have a number of growing studies for this in dogs and a lot more studies in people. In addition to inhibiting muscle atrophy, it also has antioxidants that are also derived from the egg yolk. And if anyone has a much older dog or has gone through this, we know that dogs, similar to people, undergo cognitive dysfunction, so kind of the human correlate of dementia or Alzheimer's. So sadly, this does happen as they age. They'll start showing lots of different signs at home that can be a little bit vague, similar to signs we might see with anxiety or pain. But when we kind of put them all together, we actually have surveys for this to try to really decide if it's cognitive versus anxiety or pain, that we can help guide you if we need to be a little more thoughtful about cognitive health. Just like in people, we need to think about intellectual stimulation and regular exercise, which I know you guys are already doing a great job of. When it comes to diet, there are a few different things that different companies are doing. So one of the commonalities is going to be adding fish oil, again, which can be helpful for cognitive health. Adding in antioxidants, so it's from multicolored vegetables. They're actually really getting kind of higher levels of antioxidants from these vegetables into these diets that are made for cognitive health. So pretty profound levels of antioxidants in these diets, but it's something you can add on your dog's food at home too. So kind of lightly cooked green versus red or orange vegetables can be useful throughout life, but especially as they age. Purina has actually looked at coconut oil, so that MCT or medium chain triglyceride oil, and that, when put in the diet at about 10% of the calories coming from that for the whole diet, has shown to do a really nice job for helping maintaining cognitive function. And it's because the brain cells in the older brain, so this is for people and for dogs, can actually use this as a nutrient source better than carbohydrates, so better than glucose, like sugar. So it's a nice additive to help give the aging brain cells a nutrient that they can really use, that it can really use well. And then outside of diet, for cognitive enrichment, sniffing is actually huge for cognitive enrichment for dogs. So walking them outside in new environments, interacting with new people, teaching them new tasks, new commands, having them search for treats in puzzle toys or outside, like little obstacles, involving smelling for treats. Anything like that is useful, and also incorporating aerobic exercise, which I know you guys are already doing a great job of. There are a lot of interactive feeding and puzzle toys now on the market, that it's good to kind of get involved with your pet and even change out which ones you use for that cognitive enrichment as they age. Okay. I think I went a little bit over. I'm sorry. It was a lot to fit in in about half an hour. Any questions, any other questions remaining?
If you're trying to ask a question, just remember to unmute yourself.
And if anyone comes up with any afterward, or if others are watching a recording, Dr. Jin has my email, so just have her send them on over.
Very informative. Thank you very much.
It was great, Erin. Really appreciate it.
Yeah, that was really good. Even for a lot of people that I think have been in dogs for many, many years and know a lot, this is all good stuff to keep, all the new research and everything coming in. It's really good to have.
Yeah. This is an area that's so active in research. I mean, when I teach the students these types of lectures, I have to change them every single year with updates on what we have.
Yeah.
So,
Well,
Erin, with your service, this is Pam. Can a person make an appointment and just come in for a dietary consultation that might be taken in what their dog's problems are
Absolutely.
with joint mobility and their age?
Yep, we do preventative health appointments all the time, especially for, well, for any type of dog, but especially for sporting dogs. I did a little bit of extra nutrition training throughout my residency. So if you are looking for nutrition, a lot of times they'll try to slot you in with me. Or I'll help my residents who might be working with you as well to make sure we're making the best plan. But we love preventative health appointments. Anytime we can see an animal earlier, I think we can make a bigger difference in their health span.
Okay, great. Thank you.
thank you so much, Erin. That's great. All right. Well, oh, anyone else with a question quick before we say goodbye to Dr. Erin? No? All right.
All right. Well, you get on with your meeting.
Thank you.
Thanks
Thank you
guys
for your
having me.
time. Yes.
All right.